tests. We need the rapid antigen tests because the point of care tests, if we give those at our testing clinics, it requires staff to do the test for the individual, to keep those individuals there waiting 15 to half an hour, and to then track all of their information and their positive result in our system. So it actually adds to the administrative burden of our testing clinics and does nothing to reduce the lines by giving us predominantly point of care tests instead of kits that people can take away. And if I can get the Commonwealth to do anything, it is give us more of those self-assessment kits for people to take home, to take pressure off our testing clinics.
So we know hospitals are under pressure. Is there any consideration being given to bring back unvaccinated health workers if they go for daily testing?
Well, look, we know that they're the greatest risk. What we are doing is we've got people being pulled back from leave right now. We have the protocol in place for essential workers. So if they are otherwise well, fully vaccinated, asymptomatic and have not tested positive but they are a close contact, then the HHSs have the authority to ask those people to come to work as well. So we've got mechanisms in place that if we need to do that, we can bring those people online. As far as those people who have chosen not to get vaccinated, who are either taken leave or are going through an exemption process, we have from day one already put in place protocols that if those people can be utilised in the health system somewhere else that doesn't require face-to-face contact with patients, we're doing that as well.
Minister, there's about 5,000 Queensland health workers who aren't vaccinated. Is that acceptable?
Look, we always knew that there'd be some who choose not to. There's, I think, around 2,800, I'm happy to check on this, about 2,800 of those who are just on long leave anyway. So people on maternity leave, long service leave, who don't need to prove that they're vaccinated until they are due to return to work. So not all of that 5,000 are people who otherwise would be at work but for their vaccination status.
And the remainder of those, are they actually at work unvaccinated? What do they do?
No, so some have chosen to take special leave, some are on unpaid leave, some are on show cause at the moment, and some are waiting for their exemption applications to be finalised.
So there's no one at work at Queensland Health who's unvaccinated?
As far as I am aware, there is no one who is unvaccinated who is working directly with patients and putting patients or staff at risk. Look, those are discussions that are being had at a national level. I think there needs to be consistency on that. Certainly, I'm not aware of any jurisdiction that says to the general public, you are not to come forward for PCR tests anymore. I think, we will get to a point that the majority of the population are just doing rapid antigen tests at home. But we are not there yet. And so, the current instructions are, if you are due for a day 6 test as a close contact and you can't get access to a rapid antigen, you can come forward for a PCR. And also if you're symptomatic and can't get access to a rapid antigen, you can come forward for a PCR test. And we're not going to tell people that they shouldn't come forward to a PCR test if they are unable to get those rapid antigen tests.